Very good morning. Happy to see you on this Saturday, 11/3/2023, Saturday, to meet you with a happy 1075 cases of Puberphonia. Today, the Saturday, we have finished successfully. So every day we are having new ideas about our research. No. It is not research. This is an invention. That's what I feel. It is not somebody's work. It is our own work. I want to be very clear. So this Saturday we want to give some more information regarding what is our next, because every day we are having new ideas about the treatment of puberphonia. This we are now more concentrating on MRI study for puberphonia boys. We have done few studies. The important thing, we are happy to have the palatal plane, and the palatal plane will tell where the sound is originating. So the technology of MRI, magnetic resonance imaging, has recently offered a great opportunity to the analysis of voice production. So voice production, a big analysis by MRI. So we are aiming, what are the physiological principle base for voice production in puberphonia and its treatment. So we will able to track the vocal tract with MRI database, and we will be select what happened to the voice, what happened to the sound, where it produces the narrowing and produce the voice. So MRI is definitely a best method and physiological during motion, voice production. So this, we want to do more cases of study of MRI, and our strength is ability to get the desired frequency and learn where the frequency sensation are felt as the patient speak correctly. The patient and the technician and doctor should fall in love with that technique. I am able to hear from the high frequency to low frequency. Patient perceive. We are able to change. So the patient should understand, and he should fall in love with the technology and where you got the correct voice. So this had given us, this MRI and further study had given us a new scope for learning more about the consonants and vowels. But there is a lot of difference in languages. Whatever may be, there are 26 letters in English, out of which 5 are vowels, A, E, I, O, U, and rest are consonants. So in English, only 26 letters. But in our own Tamil language, what happened is there are 12 vowels and 18 consonants. And these 12 vowels and 18 consonants combined to form 216 letters. And then one special letter is called as Aida Eluthu. So totally 12 plus 18 plus 216 plus 1, it will come to 247 letters in Tamil. But very happy, because in Tamil, our language, the consonants is once again classified into 3: Vallinam, Vellinam, Idainam. Letters which are hard, very hard sound are Vellinam, soft sound or Mellinam is called as Idainam. Vowel sounds are called life sound. Uir எழுத்துக்கள், soul letters. It is the soul. Together with the consonant, we call as body of the letters, soul and body. And they come from compound letters called living or embodied letters. That means the letter is having body and soul. What a great. So English is having only 26 letters. Easy to learn, you feel like that. But which is having a life mean Tamil language, which is having 247 letters. That also we are happy because the consonant Vallinam, Mellinam, Idainam. So consonants are divided into 3 according to the resonating chambers the letter are pronounced from. So treatment for Puberphonia is over if you know Tamil language letters, how they are originated. Very simple. How God had created Tamil letters. Everybody know Tamil letters are created by Siva, Lord Siva. So the Vallinam is Vallinam means means strong birds, hard birds. Kasana Tapara. Then Mellinam, which is originating from the nose. Ngengana Namana. Vallinam is originating from the chest. That means it is the resonating chamber of the letters. Then Idainam, that is in between chest and nose. That is the mouth tone. Yarala Valala. That is what we needed. So that is coming at the region of the uvula is Yarala Valala. Here also very interesting thing is law. So 3 letters are there, which is there in not only in Tamil. We know that Malayalam also having the same word, law. Valaypalam. So that is the gift given by God to Indians. We love the language anytime, anything. We give the importance for language to the mother. So such a thing, it is easy to learn puberphonia and treat puberphonia. That's all. If you correctly know the letters and where it is originating, where it is coming. So phonemes in linguistic, the small unit of speech distinguishes one word from the other word. The linguistic or phonemes we can learn easily in Tamil language. Vowels are sound made by allowing breath to flow out of the mouth without closing any part of the mouth or throat. That's called vowels. Consonants are sound that are made by blocking of air flow out of the mouth with the teeth, tongue, lip, palate. So, so there is a friction in consonant. Vowels, there is no friction at all. So in pedology, vocal understanding, head and chest resonance is very, very important. For a long time, there is a gap in the characteristic of head voice and chest voice. This there is a lot of controversy. Where is the head voice? Where is the chest voice? Mostly one believe on personal feeling, believe only, because so many languages are there. So many people say whatever you feel, you are personally feeling, you take it as head voice or chest voice. So this is in search of the explanation we are going on. So the signals laryngeal surface or the resonating surface, we can find out whether the patient or the person is having head voice or chest voice. So head and chest, the difference is only a personal feeling. There is no definite demarcation in uh, the literature. So there may be good references, but in our experience, what we feel, personal feeling only. So head voice, they say they are having high vowels, chest voice, low vowels. So there is a correlation between head voice and chest voice. So if you are able to track where the sound goes and what is the thing happen, we are we ENT surgeon, we ENT surgeon who are treating puberphonia, more younger generation should come and they should learn not only English but Tamil consonants also. Then only really they will be able to understand. So what will happen? Because Tamil literature is having more information on the origin, where the letters are originated. This is my feeling. What I am feeling is a personal feeling. This can be changed by the future scientists. So somebody have the idea English alphabets are only 26 and but Tamil alphabets are 247. Yes, in Tamil letters there is உயிரெழுத்து, உயிர்மை எழுத்து. Once again, depending upon the resonating chamber, they have divided into Vallinam, Millinam, Idainam. Those who are coming from the chest, those letters coming from the nose, those letters coming from in between. So it's such a fantastic opening you are having if you are having the opportunity to learn Tamil alphabets. ENT surgeon who want to know the best method of treatment of puberphonia, just translating what is already given in English textbook into translating into Tamil is good, but this won't serve the purpose at all. You have to learn Tamil literature and transfer it. This is very difficult to digest or understand. This is my personal feeling. Translating English book to Tamil book is not going to solve the problem. You are not going to become a researcher or inventor. Provided you follow your own language and write book. So this is my personal feeling. Some person who was listening my voice, they will understand. Little more work in translating English book to Tamil is there. You should able to get our own language and translate. That means no direct changing of words from in British or American books or European books into Tamil. It is not going to solve our research. That's what I feel. That is a small thing. My personal feeling I got while treating puberphonia. Okay, because why telling? Speech production involves three parts. Yes, vocal cord vibration give a life to the air. That's all. It gives the life. But the resonance that gives a real spirit to that voice. Resonance in the nasal and oral. So that we should be able to understand if you really follow Dolhopium or other Tamil books. Because I am going to tell, this may be a controversial factor for the people who are learning British book. But what I have to do, I have learned that in our Tamil literature, so I have to tell. It is my duty to tell. There are six main resonating areas in our body. Six. Definitely, that are all larynx, pharynx, mouth or oral cavity, nasal cavity, skull cavity, upper skull cavity, and then chest. While speaking, it mixes these depending upon the words what we are using. The first place the resonating occurs at the larynx. When they exhale, breathe, charges with sound wave, it passes through the vocal cord. That's all. When air passes through the vocal cord, it is charged with sound wave. That's all. No word is produced. See, this is purely my personal feeling. Next, some good scientists, good thinkers will come and they may change the ideas. Vocal cord is not a voice box. It only charges the exhaled air with sound energy. Any surface coming in contact together, if you blow air, it will make noise. So only noise is generated which is not heard outside at all. It is not a voice box. So this everybody has to understand. For that, definitely exhaled breath change charges with sound wave as it passes the vocal cord. Then it starts a chain reaction as the sound travel next vocal resonating points, changing and intensifying. Very important. Not only changing and intensifying, it depends upon how you manipulate your muscle, especially in the mouth, throat. There only the important things comes about uvula. Uvula manipulation. How you manipulate the uvula, it's in the oral cavity or nose or sinus depends upon how you manipulate the uvula. So the important resonator is the pharynx. It passes way between nasal cavity and oral cavity above below larynx. The amount of resonance produced depends upon how much air passes through the pharynx and what velocity. So, do you think the velocity in the level of vocal cord is similar to the velocity in the uvula? No. Venturi effect is there. Try to understand. There only the Venturi effect will come and play. Where you are going to increase the velocity and resonation. Where the resonation increases? At the oral cavity, at the nasal cavity. Nasal cavity, the air go above the tongue and it also produces sound energy. Words are formed because the tongue touches the surface of the tooth, gum, and hard palate. So where the energy? This is the same amount of air? No. Venturi effect is there. Venturi effect easily demonstrated. Air is coming from larynx, trachea, lungs, and goes to the mouth and nose. Is it the same pressure in the lungs or trachea, in the vocal cord, or just above the vocal cord. No, 1,000 times bigger in when the air goes to the mouth or nose or sinuses. That is called Venturi effect. If you want to blow air, just like you're making a fire, you will keep the track near your mouth a little distance. If you keep it near your mouth, the force of air coming out is less. But if you keep the mouth, the air blowing little away from the mouth, the air flow is more. That is called Venturi effect. That part is played very much at the level of uvula. So where the energy comes, energy is there at the level of uvula, because from the nose also, from the atmosphere also, air enter into the mouth by Venturi effect. This is what we have found in MRI. That I will be able to explain every day. So if a thing is going to vibrate, try to understand. So this paper has to vibrate. Close means less. Little away means more air is going and oscillating. Very simple. That's called Venturi effect. So, how much velocity it is produced, what is the cause for it, think for a while. And if you think this is only because of knowing actually what is the great resonators, what happened at each level. So you should think and more about uh, the resonating chambers, which are not only larynx, it may be larynx, pharynx, the mouth, nasal cavity, upper skull cavity, and the chest. So these are the things very much required. So the time is 5:30. I'm just closing my small talk. We'll meet next Saturday. Thanking you. Great thanks for all the help given by the divine force. Thank you. Great.